Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon and founder and creator of KaramMD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about a very interesting and important topic, and that is how to best use fillers to manage your aging process, and along that, what to avoid that could get you into a lot of trouble, that could actually potentially make you look older and actually deformed. So stay with me. I think after all this, you'll see where fillers exist in the toolbox and where they do not. And before we get into that, let's break down facial aging so that you can understand where volume, aka fillers, fit into that spectrum and what type of tool it can be used for. All right, folks, so here's how it goes. Think about aging in a very simple way as having three basic components. On one hand, you have skin aging. So what's happening there? You're basically getting fine lines and wrinkles as you begin to lose more and more collagen decade after decade. You start to see pigmentation, discoloration, you see dullness, you see pores. Crepiness, dullness, fine lines and wrinkles, breakdown of the actual structure of the skin. Year after year, decade after decade, starting in our 20s and 30s, this is what's happening. The next component is volume. What you have in your face is a combination of subcutaneous fat, which is fat directly underneath your skin, and then you have fat pads. Fat pads exist in the temporal region, above the eye, under the eye, in the lips, in the buccal region, and even a little bit down around this area along the jawline. These are deeper fat compartments that basically soften the look of a bony face, because again, the face is skin, fat, and bone, right? I mean, those are the layers fundamentally of the face. That's the second component. Third component is laxity. That's what happens when the face starts to lose its integrity, loses its shape, and as a result, it starts to stretch. And as that stretching process occurs, the fascia starts to get longer and longer. You start to see extra skin around the eyelids. You start to see drooping of the corners of the brow, puffiness, and extra skin on the lower eyelids. The upper lip gets longer. The midface starts to encroach on the nasolabial folds. That starts to get thicker. Jawline starts to see jowls, and of course, the neck starts to sag. A lot going on with the facial sagging aspect of things. So you've got skin, volume, and sagging. Now, keep these three things very organized in your mind as we begin to discuss where fillers fit in and how you can address them. So here's how it goes. As I mentioned, volume is there to create a particular look that is softening and healthy looking, right? It's actually very beautiful as well. But it's not necessarily consistent with looking young. This is a very important point to remember. Very, very important to remember, because there are tons of teenagers and 20-year-olds that you'll see after we watch this video and you start looking around, you'll start to see their mid-faces are very hollow. They have hollows under their eyes. Their temples are hollow. These are genetic changes in some people that are not necessarily, when you look at them, you still know they're teenagers and 20-year-olds, but yeah, they look a little bit less tired, maybe even less attractive. If they had a little bit more volume, it'd be prettier or more handsome looking, but doesn't necessarily mean you look older, right? This is super important. Now, what you won't see in a young person is sagging jawline and neck, and you certainly won't see aged-looking skin. Young-looking skin and young facial shape are the two things that fundamentally make a person look younger. Now, why that's important is this. Somewhere around the 90s or so, fillers and the concept of volume started to really gain traction. More and more companies started coming out with different types of fillers, more sophisticated fillers. In the beginning, if you recall, it was just collagen, and the collagen was just used a little bit in the lips. It lasted about 3 months, it was gone. You put it in the nasolabial fold, same thing is gone. The fillers started to become more sophisticated as the hyaluronic acid products started to become a bigger play, and then all different types of hyaluronic acid consistencies started to hit the market. So you've got the thin stuff, you've got the medium thickness stuff, and you got the heavier stuff. All different brands coming out with these different versions of it, used in ways to basically avoid surgery. Now, this is where it gets key. When you're trying to avoid surgery, what you're telling yourself is the changes that are happening with sagging, you're trying to basically bypass them by using fillers, right? And what we've seen during this basically 20-year era is all different types of strategies. Putting filler in the cheekbone area. Voluma was a big one for this. Putting lots of volume in this area. Putting volume along the jawline. All of this to basically create a look that would be satisfactory, would look quote unquote younger, and therefore make a person feel like they don't need to have surgery. What we've learned is that not only does it not work, but it becomes a slippery slope, because as you put a little bit when you're younger, you're like, I like that look, right? You're late 30s, early 40s, you put a little bit of volume here, looks good. You put a little bit of volume in your pre-jowl area, it looks nice. A little bit under your tear troughs, you're like, okay, this is good. This is a great tool. I'm really looking better. But then what happens is you get to your 40s, mid 40s, late 40s, and the sagging really starts to settle in. Then, not only are you using the same amount, but you're starting to use more and more of it, because you think you can basically get the same effect that you were getting when you were in your 30s by putting in more filler. Then what ends up happening is the fillers start to make the cheeks look bigger and bigger and bigger. And what we've learned is that putting a lot of filler into the face doesn't mean that filler is all gonna go away the day you decide not to. In fact, just today I got off the phone with somebody who I had a consultation with, and they had a lot of volume in their middle face, and they said it's been 7 years since they've had filler, but they were using it for like 10 to 12 years prior to that. We're on a consultation for a vertical restore. But I mean, the mid face was just overly filled, it was basically deformed. And she hadn't even put it in for 7 years, so keep that in mind. Result of all of this is that we've learned that you cannot avoid having surgery by putting in filler. But there is a way to use fillers that can create a very natural, purposeful approach to anti-aging that doesn't hurt anything and doesn't overdo it, but it's important to know where and how much you put into this. And that's the point of this topic here. So I'm gonna just summarize real quickly before I get into the exactly the specifics. So number one, skin ages. You can manage your skin aging by directly addressing the changes that are happening to your skin. There's a bunch of videos that I've created just on that topic, so check those out. They're linked right here. When it comes to sagging, same thing. I've talked a lot about this topic, and I'm going to talk more about it in future topics, but those are surgical changes. My vertical restore technique, facelifts, neck lifts, those type of things can address these changes. That's related to sagging. Upper lids, lower lid blepharoplasty, that addresses those changes. Now, we're going to focus on volume. So if you've got sagging, if you've got skin aging, you got to treat those things, with the appropriate approach. The only thing you can do with volume is replace it. Keep this in mind. This is a completely different paradigm than what you've been used to doing and what you probably have been getting when you go into the med spas and derm practices and plastic surgery offices, before this point. What I mean by that is, as I mentioned, during the aging process, you begin to lose a little bit of volume in specific areas. Your purpose of using fillers or me using fat transfer or other surgeons using fat transfer is simple, just to replace the lost volume. And when you do it that way, you will not get yourself into trouble. You will not create deformity, imbalances, and problems. So here's the areas that you lose volume. So let's start with the top of the face. We lose volume in the temporal region. Temporal fat pad, subcutaneous fat begins to diminish. You start to get a concavity in this area. That area can be augmented very, very effectively using Sculptra, using hyaluronic acid fillers, and using fat transfer. I'm not gonna say fat transfer over and over again. I'm just gonna say everything that I'm talking about can be treated with fat transfer as well. But not everything that can be treated with fat transfer is necessarily ideally treated with other fillers. But just know that everything in my practice, I replace all volume with fat transfer, generally speaking. My nurses and nurse practitioners use fillers in the same way I'm describing here to replace the lost volume in the patterns that we're talking about here. So here we go, review. Filler in the temple. Wonderful. Upper eyelid region, lower eyelid region. If it's a subtle amount of volume loss, and this is very, very important, subtle amount of volume loss, fillers work really nicely here. What I mean by that is if you got a tear trough deformity that basically goes to about here, putting in between 0.2 to 0.3 cc's of a filler like Restylane, for example, under this area here along the bone can have a beautiful effect. If you do it there, you do it literally like once a year, once every 2 years. You don't go back and do it over and over and over again. If the volume loss is all the way through here, maybe you can spread that volume out through that area, but if you put a lot of volume, you put a whole cc under your eyes, you're bound to end up getting Tyndall effect or an accumulation of fluid under that area, which causes that area to be puffy looking. This happens all the time with people who have fillers under their eyes. So small amount of volume placed under this area can be very effective. Same thing goes for above the eyes. A little bit of volume in that area can be very helpful. However, if you have extra skin or puffiness under the eyes and you're putting volume in there to mask that or to fill that, first of all, if you put it up here and you have excess skin, these are really important nuances to remember. If you've got extra skin on your upper lids and you put volume in this area, you're actually gonna make your extra skin look heavier because it's gonna push that skin down and you might not like the effect. If you got a little bit of volume loss under here, great. If you got puffiness and bags and extra skin here and you put volume under here, literally you'll barely see any change there because the excess skin and puffiness from the fat pad of your eyelid is gonna basically overwhelm any volume changes that you get there. So that's where blepharoplasty for the upper and lower eyelids come into play in conjunction with volume loss. Keep that in mind, really important. Here's an area where I never put volume. Middle of the face, outer cheeks. If you start to see basically like a trough in this area that comes all the way down here, if you put your finger here and you lift, and that basically brings your mid-face back up, what's going on there is you having mid-facial basically descent or sagging in the mid-face. Your mid-face is starting to drop. And then you'll see a thickening of the nasolabial fold. That's not the same as having a volume loss problem. And if you try to put volume in there, you're just gonna create this kind of unnatural looking apple cheek with a heavy nasolabial fold region. And that doesn't look right. Most people make that mistake constantly. Most injectors, most doctors, most patients, they see this hollowing in here and they start to put a lot of volume here. More and more and more becomes necessary as the face sags more and more. And as a result, you end up with this tremendous amount of volume in here. This area, same thing. You have a little bit of a volume loss that might happen in that region, but it's usually very small. And what also happens in that area is this bone is your facial anatomy. It's your structural anatomy. You can't put so much filler in this area that you create a cheekbone. So either you have a high cheekbone or you don't have a high cheekbone. But if you have a high cheekbone and you add more volume, it's gonna make it look really weird. Or if you try to emulate the high cheekbone look by putting lots and lots of volume in there, it's gonna look weird. So you gotta use volume very judiciously in these areas. Be very, very mindful you don't use. I rarely use more than like 1 cc split between two sides. And if I do put a little bit in this area, it would again be like half a cc in that region. I'm giving you volume so you understand that you shouldn't be going in there and getting like 2 or 3 syringes of filler into these areas. Another area, as we go down nasolabial folds, nasolabial fold usually is a result of the cheek falling forward, so putting a lot of volume in there isn't gonna help. But this area at the top of the nasolabial fold, we call it the pre-canine fossa, there's a fat pad under there, there's some bone loss that happens with age, so putting a little bit of volume directly in this space here can be helpful. So using volume in this region, in again, half a cc amounts can be useful in this region. You're replacing the lost volume. As we get lower into the face, lips, lose volume for sure. Adding a little bit of volume back into that area can be very helpful. Again, relatively small amounts. Don't go for these big augmented lips. They're not gonna look right. And as a result, they're gonna look very artificial and unusual. Caveat, if your upper lip is getting long and as a result getting thin, putting volume in there, you're gonna be bound to look like a duck. It's gonna give you a duck look. So what that means is if your upper lip is starting to sag, putting volume, even in small amounts, is gonna look unusual because most of your red lip is actually tucked inside your mouth. So that's where a lip lift comes into play. You have to actually bring the lip up in order to expose it. Very important. These are all caveats that go along with it. But in general, you wanna replace some of that volume. Now here's where it gets funky. People see sagging along the jawline and they want to pound it with a bunch of fillers. In the pre-jowl sulcus, right in through this area, in this part of the jawline, because the neck starts to sag, so they want to pull this out further. They put a lot out here because they want to basically create an impression on the side view of having volume here. Here's your jowl coming down here, so you're putting volume out here, you're putting volume here, you're putting volume here. But guess what? The second you face somebody, you look like a linebacker. You look like a masculinized, heavy-looking face. On the lower half, you're putting volume in front of and behind areas where there's soft tissue loss, but that's not natural. You don't get volume loss here. You get a little bit of bone and volume loss right around here, so small amounts of volume is okay here, but not heavy amounts. And certainly the same thing, if you have a normal sized chin and you put a lot of volume in here to kind of go out further to mask a sagging neck, it's gonna look weird. So here are the areas in review. Small quantities of volume, temple, above the eye, tear trough, pre-canine fossa, upper lip, lower lip, pre-jowl. These are all areas that you lose volume, putting a little bit back works beautifully. I do this with fat transfer in basically all of my vertical restore cases. And the beauty of fat is, of course, is it's natural, but I don't put a lot of it in because I'm lifting all the soft tissue at the same time. Now, if you're getting older and you're starting to see sagging happening, don't be disappointed that going in there and getting the fillers done in the areas that I just mentioned, in this amounts that I just mentioned, isn't gonna create that much of a change. Because once you start to see sagging, even if you're replacing volume, the effect of volume augmentation becomes less and less basically impressive or important. Volume loss and volume augmentation works best against a firm soft tissue envelope. Ideally, when you're in your 30s or early 40s, you're starting to see a little bit of volume loss, but for the most part, your face is pretty tight. Putting volume in the areas I just mentioned can have a gorgeous effect. Even a little bit of volume in the cheek, if your mid-face is a little flat but it's still firm, adding a little bit of volume there can be very pretty. However, if you're trying to address it by trying to bypass surgery, like ignoring the fact that your face is sagging and putting volume in all these areas, you're bound to use too much volume. And if you use the appropriate amount, you're basically not going to see much of a change, so you'll be disappointed with the results of the procedure. So what typically happens is, as I mentioned, you use it when you're a little bit younger, you start to feel like you need to add more and more to get a real effect because you're losing. So then you're starting to get into this cycle of like coming in every 6 months, putting volume. Face starts to get more and more, bloated and puffy and unusual looking. And then you find yourself after 5 or 10 years of trying that, throwing your hands up saying, geez, because you see a picture of yourself or you see yourself on a video and you're like, who is that person? Or somebody who has the courage to actually tell you, and be like, hey, lay off the fillers, you're starting to look a little funky. Don't get yourself there. Avoid that happening by understanding that volume has its place, laxity and the treatment of laxity, which is surgical, has its place, and skin treatments have their place. All of these things have to be done in conjunction with understanding that basic paradigm. And if you go about it this way, you'll see nice improvements, even though they may be subtle as you get a little bit older, or you'll just have at least an awareness of whether or not you should even bother doing these treatments the way I just described them, or whether or not you should say, you know what, I'm not even gonna bother doing more fillers because I'm 55 and my face is starting to sag, and I'm just gonna save my money and save my time and everything and get a vertical restore or some other type of lifting procedure to bring everything back up into position. And then, if your surgeon doesn't do fat transfer, then you can use fillers to augment the areas that I just talked about. That's the right way of addressing things. That's the way to keep yourself out of trouble. All right, folks, I hope that helped put everything in perspective. That was a very thorough, I think, analysis of the process. And I think with this information, you're in really, really good control. Share this with your friends, your family, share it with your injectors, your doctors, whoever who you want to basically discuss this topic with. And if you haven't already, subscribe to the channel, get more information like this. Comment below if you have any questions you'd like to add, or if just let me know what you thought of the discussion. And until next time, folks, Dr. Amir Karam.